There have been many dark times during the pandemic, but we're at a time where we're seeing the light, and we can all be part of making that light brighter. The ability to ward off a multitude of diseases through vaccination has been one of the greatest public health successes. With successful vaccination programs, we've been able to eradicate infections like smallpox and polio that have caused many deaths and disabilities in the past. We know the efforts of annual influenza vaccinations help save the lives across the world. Now we have a group of safe and effective vaccines that can keep people from being impacted by COVID-19. I hope you've been able to receive yours already. And if you have not, I can offer some guidance and reassurance about the process. Now that vaccines are available for those age 16 and over and supplies are increasing, there are ample appointment slots being made available through various sources. If you're looking for an appointment, please check your local health department website. You'll likely have options to choose a state or county-run site, or even slots at local pharmacies or even your doctor's office. Many sites are starting to offer a limited number of spots for walk-in individuals. If you're hesitant about getting the COVID vaccination, please speak with your healthcare provider or maybe a trusted friend who has done their research and received the shot. When I'm asked about my own personal decision to be vaccinated, as well as recommending it for my family and friends, I reflect on how I followed the vaccine development for over a year. And from the beginning of the pandemic, I've been amazed at the global scientific response that brought together private and public sectors to support the vaccine development. Over a decade of work on the mRNA technology that the Pfizer and Moderna products use has allowed it to be developed at a quicker rate, mainly because of the type of technology and because of the global funding provided to roll out clinical trials. Having COVID everywhere during that time also helped to provide data on how successful the vaccines would be and whether they were protecting people or not. So now it's your turn to get protected and continue protecting others, as well as not being an unknowing habitant for the virus to infect yourself and to mutate. We know there have been some people or populations who cannot get vaccinated due to medical reasons, or is in the case now, their age. That is why it is all the more important for everyone that can get vaccinated to do so and do so quickly. Just like other vaccines, not everyone who gets vaccinated builds up 100% protection from getting infected. So again, that's why it's important to move as close to the 100% vaccination rate as possible. The good news with the COVID vaccines is that they do offer a high protection rate, and those that happen to get infected after being fully vaccinated appear to have mild or even no symptoms and are likely not as contagious as a non-vaccinated person. And keep in mind, even if you were previously infected with COVID months ago, the immunity you produce is likely very short-lived, likely only a few months. After working at dozens of vaccine clinics in the past few months, I can say firsthand the vaccines are well tolerated. Most people say they don't even feel the shot. Severe allergic reactions appear to be very rare, and those with concerns are monitored on site for an extra period of time. The only responses I have seen are not allergic, but from our body's own nervous response system, especially in younger people where their fight or flight response is often very high. We sometimes see them feel lightheaded after the vaccine. If you have had a history of fainting after shots or giving blood, let your vaccinator know. If you're anxious, also let them know. They can provide reassurance and help you relax and take deep breaths. Our best chance for eradicating COVID-19 and not seeing it reemerge in 2022 and beyond is widespread vaccination and continued precautions until the virus no longer has suitable hosts. We started this pandemic response with the motto, "We are all in this together," and that continues to be true as we fight to end it. Our updated motto should be, "We are all vaccinated together."